think we'll get started. Welcome everyone to tonight's session. Tonight we'll be discussing land and women and children's health. So some of the things we'll discuss tonight will be how access to land and secure land rights affect women and children's health. We'll hear some examples of conflicts between customary traditional laws and formal laws. And we'll also discuss some legal mechanisms for improving women's ability to secure land rights. And so we have three great panelists here tonight. Dr. Judd Walton will give us an overview tonight. Judd is a faculty member in the Departments of Global Health, Internal Medicine, Pediatrics, Epidemiology, and the Division of Infectious Disease. Judd is conducting several clinical trials evaluating the treatment and prevention of intestinal worms, malaria, diarrheal disease, as novel mechanisms to delay HIV progression. He is also conducting a large 5-year study examining the epidemiology of non-typhoidal salmonella as a cause of diarrheal disease and bacteremia among children in Africa. He has worked in many international settings, including Kenya, Thailand, and Nepal. He is also the co-director of the Strategic Analysis Research and Training Program, the START program, here at the UW. And he'll provide our overview tonight, and we'll discuss some of the work he's doing with child malnutrition in Kenya. Elisa Scalise is the director of the Landesa Center for Women's Rights. Ms. Scalise is a land law and policy attorney specializing in women's access and control over land. Her geographic experience includes Australia, Burundi, China, India, Kyrgyzstan, the Netherlands, Rwanda, and Uganda. Her work has covered the analysis of formal and customary law and property rights, inheritance, and marital property regimes, evaluating formal and informal dispute resolution mechanisms, and drafting practical plans to ensure that the most vulnerable members of society benefit from land tenure reform efforts. She has experience in international and comparative law in both civil code and common law systems. Ms. Scalise will discuss her work with Landesa, conflicts between customary and formal law, and ways in which to improve women's land rights. Dr. Susan Bolton is a professor in the School of Environmental and Forest Sciences, the College of Environment at the UW. Dr. Bolton has graduate degrees in both ecology and engineering and is a registered professional engineer. She has been a faculty advisor to the UW's student chapter of Engineers Without Borders since 2005, is a member of their Faculty Leadership Council, and also sits on their board of directors. She has worked on projects dealing with international sustainable development in Costa Rica, Bolivia, Peru, and Guatemala, where she has worked on drinking water, irrigation, composting toilets, green space, and improved cook stoves to reduce indoor air pollution. Recently, she completed a literature review of interactions between HIV and the environment for the International Union of Conservation of Nature and the International Planned Parenthood Federation of Kenya. Tonight, Professor Bolton will discuss ways in which inheritance laws have affected the HIV/AIDS epidemic in East Africa. So, with that, I will Dr. Judd Bolton.
Great. Well, it's great to be here, and I heard a little bit from your course directors about the incredible breadth of expertise in this room and the different, I think we even have people in Swedish studies. I was very impressed. Scandinavian studies, sorry. And I think actually it's interesting to me as well, because what I want to talk to you a little bit tonight, as I present a little bit of, I guess, an overview of this topic, is how, as a doctor, a pediatrician working in Kenya, I came to think about land, which is not maybe the most obvious thing in the world. But I'm going to tell you sort of the anecdote that led me to understand the relevance of land practices as they relate to malnutrition. And in doing so, I hope we can start to frame in our minds some of the choices and decisions that families make in resource-limited settings like Africa and Asia, and how land plays into those. And I'm not going to speak in great detail about that because I'm a doctor. I'm not a lawyer or a land use person. But I think from an outsider's perspective, I hope to be able to share a little bit of insight into how we might start to frame that, and then let our experts help guide us through a little bit of that discussion. So I started out, actually, interestingly enough, as a cultural anthropology major in college. And I never took any science except astronomy, which I got a C- in, and mostly for lack of attending. And my only familiarity with the law at that point probably shouldn't be repeated in this room. So I really didn't have any desire to be going in this direction. My only familiarity with the law, just to be clear, was that I dropped out of college actually after my first semester, and I went and became a street performer in Europe and joined a circus. And I ended up kind of running into some trouble with the Belgian police at one point, which related to lack of having a street permit. So it wasn't that bad. But anyway, I finished college after doing anthropology, didn't really know what I wanted to do, and found myself eventually living in Nepal for 3 years, and eventually working on a project trying to understand barriers to access to care among the Sherpas living in the Himalayas. And the reason I tell you this is that I think that experience served me well as I start to relate to you the story that I'm going to about what happened to me in Kenya. And that was starting to think about our interactions as families and as individuals with healthcare systems and our prioritization of our own health and treatment of disease in terms that aren't really just about finding a drug or finding a vaccine, but rather that there's a whole lot of societal determinants of our health, and land is a big component of that, and how we both acquire, keep, and use our land. So, with that, I'm going to tell you a little bit about how this happened in relation to nutrition. So I happened to run a small program with Manish Batra and Suzine Pack-Gorstein with Seattle Children's Hospital and the University of Nairobi. And it's a joint training program in pediatric child health, in which residents from Seattle Children's spend time with residents from the University of Nairobi working in a community in Western Kenya to try to understand better some of the community factors that affect health of children. So they do a lot of surveys and go out and they try to find intervention points that are outside of the health facility, which, striking as it may seem, is not something that we routinely do in medical school or residency. Really, we are largely based in clinics and hospitals, so this is an opportunity to understand that health starts in the home. And there's been a whole lot of interesting interventions, largely related to nutrition, because what happened when we went out to Kisii, Kenya, was that we asked the hospital and the public health officials in the ministry and others what the top health priorities were. And as many of you probably know, they could rattle off a list of the things that many of us read about being big health priorities. So malaria, diarrheal disease, pneumonia and respiratory disease, HIV, all made that list. But interestingly enough, Kisii is located in an incredibly agriculturally rich area of Kenya. Some people say one of the most agriculturally rich areas. You walk around and there's beautiful, beautiful greenery everywhere during the rainy season. There's a lot of crops. You see corn growing, lots of diverse crops, a lot of livestock. Average family actually has about 19 different animals if you count the chickens and all the animals together. So it's actually a pretty rich, resource-rich area in that sense. And so when we asked them about malnutrition, we were sort of told, no, we don't really have a problem with malnutrition. This is a really rich area. So we went ahead and started looking at causes of hospital admission and causes of death. And in fact, what we found was that malnutrition was one of the #1 causes of hospital admission. About 30% of those kids died. Most of them died within the first 48 hours of hitting the hospital, suggesting that anything we were going to do in the hospital was unlikely to have much of a benefit. These kids were coming in too late, too sick. And we brought that back to the ministry and actually started a whole new discussion, and it was very interesting, and people were really shocked and really surprised. And so what's going on? So following that, we decided we'd go out into communities and speak with women in the households predominantly and ask them, what is going on? Why in this area where we can see that you have a farm and you have crops growing, why are your kids having trouble with nutrition? What's going on? And obviously this is a complicated issue, but what they told us was that they felt strongly that a lot of it had to do with the trees. So I'm going to get back to that in just a second. And before I do, I want to just ask everyone here, so let's pretend for just a moment that we're no longer sitting in Seattle in the law school. But let's transport ourselves for a second in our imaginations to living in rural Western Kenya as a family, and think about the lives of a father and a mother and their 6 or 7 children, and what they've experienced in their life, and the choices that they make in their life, and how those are impacted by what they've experienced. So, a father who maybe is in his 40s, who was the first in his family to complete primary school, who grew up and saw around him families who were very much dependent on farming, and who had diverse farms that essentially fed their family, and that there was very little cash income 20, 30 years ago. There was a small amount that you might, sell a little bit of surplus or make some exchanges, but largely farmers were self-supporting, and farms were as well. And a marker of success back in the 70s and 80s, I think for a lot of families, they would tell you was being educated, increasing your educational level, and having, well-fed families. And over the next 20 years, as you grow up and you finish primary school and you learn in school about the importance of education, and you actually come home and tell your family about the importance of hand washing and getting vaccines because you're learning this in school, and you, who maybe 30% of your siblings or 20% of your siblings didn't survive due to common diseases, now you see that your own kids are living, they're getting vaccinated, they're doing well. And now how do we start to think about measuring success? Well, we're now in a market economy. We have cell phones. 94% of Kenyans, I believe, have cell phones. We now start thinking about going to the city. We look around us and we see that maybe education isn't the biggest payoff in the world, that the 6 guys we know who finished high school, 3 of them are living in the slums of Nairobi and working as security guards or as shipping agents, and the other 3 are back home in the village pretty much doing nothing. So starting to question really what's the value of that. But we see our neighbors and we start to say what makes me stand out as successful. And it starts to be material things. It starts to be owning a radio, having the newest phone, being able to have a big wedding for my daughter. These are the things that start to increasingly become important, and we start to shift the way that we use our resources and our land from a diverse set of crops that feed our family to more mono-agricultural practices. We can buy bulk chickens as hatchlings, grow them up, sell them at a profit in the market. We now have a cash economy. We can go to the market. We can buy things like all the things I mentioned, like beer. We see TV. We know that what's associated with success. We watch James Bond just like we do here in Seattle, and all those things of nice clothes and social events are important. And at the same time, we don't necessarily have the same ability to ensure that our family is being fed in the same way as before. We're not necessarily in tune to the importance of a diverse food stuff. It's certainly cheaper to buy high carbohydrate rich foods, just as we see among impoverished societies in the West. High calorie, low cost often takes precedence over more diverse, more nutritional foodstuffs. And so you start to see why, and I think if we think about it, why people would start to make decisions about the way they use their land. It starts to make a little more sense that these aren't irrational decisions. These are really decisions based by families in really solid experience of their life. And that's really important as we think about interventions. So let's get back to the women's groups that we met with in Kenya and the fact that they felt like a large part of the problem with nutrition in their communities might be due to the trees. So it turns out about 20 years ago, 15 years ago in Kenya, there was a rapid development going on and an increasing need for industrial supplies and a lot of plants that made pulp out of wood, a lot of need for timber to create the light posts to actually run electricity, to create housing out of wood. And so the government was increasingly looking to support a really weak timber industry, which didn't exist essentially, to be able to protect some areas that were protected forests, but also produce enough trees for development. And what they came across was that the use of fast-growing trees like eucalyptus could actually really sustain this market. And, hey, how about this? There's a market for it. So we can actually encourage farmers to grow trees. In exchange for selling those trees, they get money. They can develop in terms of economically and buy food for their families and get health care and all the things we want with economic development. At the same time, we're supporting the industries related to timber. We're getting more timber available for all the things I just described. This is a total win-win situation. And so the Ministry of Forestry and Agricultural Resources actually came out and promoted small-scale farmers planting largely eucalyptus trees and pine and other things, but largely eucalyptus throughout much of Kenya. Well, the great thing about eucalyptus is it grows in areas where there's not a lot of water, and it grows really fast. That's why it's really successful. Well, why does it do that? It grows there because it's able to suck all the water out of any existing soil and use it really, really well and really effectively. And so what happened unintentionally was a lot of water reservoirs and underground water sources were completely depleted by these eucalyptus trees. And that left very little for the plantations. So over the last 10 years, Wangari Maathai, who you may have heard of, Nobel Peace Prize winner from Kenya, and others, had really pushed forward an agenda to stop this practice, to cut down these trees, and to change the framework. And so the government issued new guidelines around where these should be planted, where they shouldn't be planted. There's been an effort. And it's really interesting because when you go into these farms, you often do see very green areas, but they're largely green because of eucalyptus trees. And actually, when you get there, the amount of farmland that's actually allocated for farming is now much reduced. And those areas that used to be more productive, in many areas are less productive. So this is an example of how families choose to develop and how families choose to exploit the resources at their disposal can have really profound influences, often unintentional, on indicators such as the health of their children. And this is now obviously a big concern globally, and a lot of efforts being paid to this. But I think it serves a couple of points. One is to just, again, remind us that issues around land and land use are not always as clear as they may appear. And that, I think, as I've told many people, the road to hell is often paved with good intentions. And we got to really be careful about how we support and how we advocate for development in many areas, because we can have these unintended consequences, particularly when it relates to scarce resources that people are trying to utilize in the best possible way. So with that, I'm going to stop and let our expert speakers give us some more specific examples about land rights and land use in relation to development and to HIV. But I hope that just having that overall framework of thinking about land use is helpful as we move forward. Thank you.
That was a really great overview and hopefully a good segue into what I'm going to speak about. If you hadn't gathered, I have an accent, and normally if I see blank faces, I either assume people are very bored or they can't understand me. If it's the latter, can you just wave? Because I tend to also speak very quickly. So just kind of let me know if you're not catching my drift. So I, as mentioned earlier, I work with Landesa's Centre for Women's Land Rights. I'm also an attorney. Just quickly, Landesa's mission is to secure or improve the land rights, really, of the world's poorest people. And we do that through law and policy, but we kind of think of that very broadly, just so you know. So it's not just legal reform, it's not just policy reform, it's also looking at how to implement laws effectively so that they reach a particular intent. And when ultimately we want to use law to bring about some kind of change. So I am going to speak a little bit about why land rights matter, perhaps going a little deeper into what Judd was just talking about. Why land rights for women in particular matter, what some of the barriers are to women having secure land rights, and then hopefully, if I haven't gone on too long, we can spend a bit of time on looking more deeply at a case study from Uganda where we're working on an experimental, or we're piloting a project there that I think is relevant and interesting to this course. So firstly, why do land rights matter? Well, roughly 75% of the 2.7 billion people around the world who live on $2 a day or less live in rural areas, and land for them is critical for their survival. About 1 billion of those people lack secure rights to the land that they rely on. So I'll stay here. So for the rural poor, land is a source of opportunity. It provides a path to prosperity. And for most of them, it's the primary source of food, food security, income, wealth, credit, power, status, access to government services, and many other things. Insecure land rights can create fairly significant constraints. They can, obviously, on food consumption and the incentive to invest, particularly on long-term productivity-enhancing investments and investments that relate to environmental stewardship. Insecure land rights can limit access to credit in some cases where it's available, and it can cause disputes and lead to conflict or instability, which then have other effects on the long-term development of a society. So with all of that in mind, why do we have to focus on women? Well, land rights are part of a bigger system of social and cultural relationships between people and land and institutions, in which, as with everything, gender plays a part. So men and women are treated differently when it comes to land rights. They act differently, they have different obligations, they have different interests, different perceptions, different needs, and they use their rights differently. So the question of who has land rights is actually very important. And if you permit me a small historical aside here, in the past, efforts to improve land rights for the poor were doing so to kind of bring about economic development in a particular place. And the idea was that land rights would lead to increases in agricultural productivity and increases in income, and then ultimately that would lead to a reduction in poverty. And what happened was there was major investments in these land tenure reform programs, and what happened was agricultural productivity increased, income increased, but they weren't seeing improvements in the indicators of reduction in poverty. So health, nutrition, food security and education levels weren't necessarily changing. And so, of course, those who were involved in this had to try to understand why that was, and it became abundantly clear that it mattered who within the household had the rights to land. So, here we go. I'm still on this slide. So just a quick snapshot of what some of the studies show about women and control over resources like land. That women are much more likely than men to spend income from resources like land on children's nutritional and educational needs. So some data from Central America shows that an increase in female land holdings is associated with increases in household food expenditures and levels of child educational attainment. A study in Nepal suggests that children of mothers who own land are significantly less likely to be severely underweight, because those women are more likely to have control over household decisions. That study is not dissimilar from what some of you may have heard of as the South Asian enigma. I don't know if you've heard of that, but looking at a country like India, economic development is definitely happening, and yet even the Indian government recognises that child malnutrition in India is decreasing despite the economic development. Another study found that there's a positive relationship between the amount of assets, including land, that a woman possesses at the time of marriage and the share of household expenditures devoted to food, education, healthcare and children's clothing. And then there's also a link between land rights and the spread of HIV and AIDS, which I think we'll be hearing about in a moment from Susan. Also a link between land rights and a decreased likelihood of domestic violence. And then a couple of studies from Uganda and Kenya show that insecure land rights for women impact decisions around land stewardship, so that land may not be used optimally when land rights are not secure. So hopefully that causes you all to ask the question, why don't women have secure rights to land? Like, why isn't it working? I guess I should have said earlier that the estimates, I think, now I'm going to really mess this up, but the estimates are around between 2 and 20% of women in the developing world have legal title. Now, title is not the only way that you can have secure rights to land, but it's between 2 and 20%, as compared to 98 or 80% for men. So just as an indication of what we're starting with in terms of women's land rights. So it's hard for me to do this and not go into a lot of details, and I have limited time. So let's see if I can get through this quickly. But essentially, the barriers to women's land rights come from a number of sources: formal laws, religious laws, customary laws, social norms and practices, and then some structural obstacles. So on the formal law side, and by formal law I'm referring to the constitutions, statutes, and very importantly, regulations, procedures. And these are laws that relate to not just land and land administration, but also marital property, inheritance, administrative law, personal status law, dispute resolution, all of these things that impact how effective a law is in practice. And those laws could be discriminatory as they're written, or they could be discriminatory as applied. Very often they are not implemented, even if they're good on the books, as they say. Or they're not implementable. They may not be known, they may not be enforced, they may not be seen as, and this is important for what I talk about in Uganda, they may not be seen as legitimate in the face of a very strong customary tenure system. And then on religious laws, similarly, they could be favourable to women's property rights, but again, in the face of strong customary laws and social norms, they may not be effective. And finally, on the customary law side, often there are protections for women within many customary tenure arrangements. But more often than not, women in customary tenure systems tend to have rights to land through their relationship with a man. This isn't the case everywhere, but it's in the overwhelming majority of places. And so that's through her father or her husband. And that's kind of related to the fact that women aren't necessarily seen as members of the group through blood. So they either marry into a group, by that I mean a clan or something like that, and they will gain access by marrying in through their husband to land that's been allocated to her husband. Or when they're living with in their father's household, they may be able to use land that's been allocated to the father. But they're kind of seen as temporary members of that household because they will marry and leave at some point. Then on the social norms and practices, there's things like the payment of dowry or bride price, which impacts the perception of, well, I guess the decision to grant, say, daughters a share in the family's wealth, and other things like that. And then on the structural side, there just could be impediments to women accessing the means that would help them ensure their rights. So access to dispute resolution bodies, permission to engage in decision making, division of labour that maybe has women out in the field all day long, and so they're actually not able to do the types of things that would help them make sure that their land rights were secure. Overall, I think the important thing to know, and for those of you who are lawyers here, I think this is important. But often the discourse around women's land rights is simplified to the question of whether a woman's rights in law are equal to those of men. And that doesn't tell the whole story. And hopefully just by going through what some of the barriers are there, you'll see that, for example, just a provision that said women and men have equal rights to land or property, as exists in many, many, many laws around the world, isn't going to be enough to make sure that those rights are equal in practice for women. So, what does secure look like? I promise I'll get to an example really soon. What do secure land rights look like for women? This is a definition that we have been working on, and I'm sharing it with you now because it helps frame the work that we're doing in Uganda. And it helps us think beyond just this, a provision of equality, and helps us think a little bit more broadly about what's really going to make a difference for women. So, a woman's land rights are more secure, or they're secure when they have a strong legal basis, but the legal basis is socially and culturally legitimate. For a woman's land rights to be secure, they must be able to withstand changes in the family or the community. This means, for example, if the household changes because, say, her husband takes another spouse, her land rights shouldn't be altered. This is obviously really important in societies where polygamy is common. For a woman's land rights to be more secure, they should be long-term or at least for a known duration. For a woman's land rights to be secure, she should be able to enforce them if they're threatened, and that includes being aware of what her rights are and being able to access institutions which enforce rights. And then finally, for a woman's land rights to be secure, she should be able to exercise them in the same way that a man in a similar context is able to. So as I said, we used that kind of framework as part of the work that we're doing in northern Uganda. So hopefully I have a little bit of time, yeah, okay, good, to talk a bit more about this project that we're working on. If you have, I'm going to go fairly high level. If you have questions, I hope you can, you'll ask about them. You'll ask them later. So in northern Uganda, customary law for land rights dominates. There are some formal institutions. They're largely ineffective. And under customary law there, land is considered owned by the entire clan, but individual parcels are allocated to household heads for their use to provide for their families. So generally a woman has a right to use land in her father's house until she's married, and then when she marries, she leaves, she moves to her husband's household, and then she gains access to his land. For the most part, she doesn't make decisions on how the land is used alone, but she can control how the proceeds of the land are used. If her spouse dies or they separate or divorce, the basis for her use of that land kind of goes away, and so she has to find other means. And what's particularly interesting, or why we decided to focus on northern Uganda, is that northern Uganda suffered from a very long civil war that some of you may know about, and that resulted in death of spouses and abandonment, or relationships kind of ended in that time frame, and so many women were left without access, or without the kind of traditional access to land that they would have had through their husbands and fathers. So at the same time in northern Uganda, in Uganda generally, the constitution recognises equality between men and women. The laws, for the most part, depending on who you speak to, recognise equal property rights for men and women. And at the same time, the land law recognises the legitimacy of customary tenure. So it basically says customary tenure is a legitimate form of land tenure in this country, and at the same time it says, and women and men have equal rights to property. And so you can see how in a situation where the customary tenure system isn't necessarily equal for men and women, this other legal provision, which says men and women have equal property rights, it creates a bit of a contradiction, or a conflict, I guess, between the two laws. So what we're trying to do with this project is see how we might be able to use positive provisions of the law to bring about adaptation within the culture, so to help make women's land rights more secure. So the goal of the project, as listed there, is to develop and test a model to improve land tenure security for women, and then to use the results to influence practice and policy on women's land rights. And I put those there because I wanted to highlight the fact that the reason why Landesa does this work is because we're interested in systemic change, and we believe that there's a big question, and it exists not just in Uganda but elsewhere, about how can you really address this. How can you address this problem of recognising customary tenure, which is the trend at the moment, and also recognise that perhaps the rights of women need to improve within those systems. And ultimately, we want to bring about the kind of systemic change that you would get from effective laws. So that's why we have the two-part approach there. We're not going to be one day out there doing this project all over the country. It's really to develop a model which we can then use back and bring back to at the national level to kind of help influence the way policies and laws are developed. So I won't go into too much detail about the components. The approach, we work very closely with a local partner. The design is adaptive. By that I mean that we do a significant amount of assessment before we even complete the design, and it's inclusive both of the community and the partners that we're working with. Again, just as I said earlier, using positive provisions of the law to influence cultural change, and importantly we engage with women as individuals and as in groups and with the whole community. So I can just talk a little, very quickly I'll just go over what the model includes. It includes training on both formal and customary law for the women, for the community, and for other influential people who interact with the community, so that's teachers who may not be part of that community but who work there, sometimes healthcare workers as well. Training on negotiation skills, public speaking, all the things that would help women be better able to address their needs. On an individual level, we work with women to help them identify what their aspirations are with regard to land, and to identify what the constraints exist to them meeting those aspirations. We work with the local community to raise awareness generally. And then we do something which actually borrows a little bit from successful practices that have, successful approaches that have been used to address female genital mutilation, and it's called, I mean, it has different names, but we call them community conversations. There are different names for this, but it's essentially bringing the community together to talk about particular issues, so that, and to hear from different people within the community as an important piece, so that as a community they can kind of understand what are the real impacts of these particular decisions and how do they affect our children, our daughters, our sisters, our wives. So it's kind of it creates a space for people to step out, perhaps, of the roles that they would normally be playing in their communities. So again, if you have more questions about that project, I'll be happy to answer them at the end of the session. The results of this pilot are not yet available. It ends at the end of this. The project actually ends at the end of this year. But one thing that I do think is helpful when we're thinking about this is to think about the lessons that we've learned so far, and they probably seem incredibly simple. But I will say, having done this work for a little while now, that unfortunately sometimes the simplicity, you know, the fact that they're simple doesn't mean that they're really, really understood by everybody. So I'm going to say them anyway. So the first thing is time. If we're working on trying to use the law as a way to bring about some kind of change, it takes time. And for those of you who have worked or are interested in working in international development, you'll know that usually you're working on a project cycle that lasts maybe 3, maximum 5 years. And so if you think about the kind of cultural change we've experienced in our own lives, it can take a lot longer than 3 years to have this kind of fundamental change. So that's just one thing to think about. And as I like to say, to the annoyance of most of my colleagues, cultural change isn't like digging a well, right? You don't just go in, dig it and leave and then everything's going to be better. It really is a very, very deep engagement. No disrespect to those who dig wells, by the way. Oh, right, yeah. So actually, I know nothing about digging wells, so I take that. That's why I annoy my colleagues, see. It's really important to understand the specific context, not impose external values. And, you know, that comes about by listening to people, listening to women, listening to local elders, listening to leaders, listening to people who disagree with what you're doing and trying to understand why they disagree. Because, I mean, this is going to really be helpful when you're trying to bring about change. And then finally, identifying places of agreement, I think that hopefully speaks for itself. And then finally, expect to be surprised and adjust your plans accordingly. I will just end now with a little story about this, and it relates specifically to this project. In northern Uganda, some people were in internally displaced person camps for up to 20 years, and once the I guess the conflict ended, that's disputable. Once that ended, the government started making moves to disband those camps, and there was a real fear at that time that women who had lost their husbands and fathers and things would be left in the camps and would have no land to use, and them and their children would be destitute. And so at the time that we were originally seeking funding to do this work, that was what we understood, and we had actually done some assessments, and that's what we were finding. Well, in between the time that make this really practical for you, but in between the time that we wrote the proposal was granted, and then we had to actually begin work, the situation had changed. We went we went back, we visited the areas, and there weren't women left in the camps. Strangely, the women had actually found, they had found ways to gain access to land, and usually it was by entering into new relationships. And perhaps using the land of an uncle or of their partner's cousin or something like that. So all that to say that we had to do a significant amount of redesign and rethinking about what it was that we were looking at, because the situation on the ground had changed. And so I think it's important to remember that you have to kind of keep on top of those things. So anyway, I have really spoken way too long, and hopefully you have questions about this. If you do have questions about anything that I've said, please feel free to ask them. Thanks.
I don't like to keep people longer than they've been assigned. So I'm going to try to bring this back to where Judd started, so we have this really good background from Elisa on how land is or isn't well secured for women in many parts of the world. And now let's talk a little bit more about some of the health issues. So in 2010, I was given the opportunity through some contacts that Judd actually had to do some work with conservation organizations in Kenya on looking at interactions between the environment and HIV. And, you know, a lot of us kind of went, huh? But it's like, yeah, they're going to pay me. I guess I'll go do it. I'll figure out something. And so we talked to many groups, many women, many sex worker groups. And we talked to people in some of the anecdote I want you to see in the upper picture. There are two chairs. I did not actually see this. The guy who was our driver sort of said, "Ben at this meeting," or saying, "This is some of the things that, I mean, women do 70% of the agricultural work in Africa overall, so they do most of that work." So let me just move on to to what we found. There we go. But what I've done is highlighted actually related to, but as with so many things, we got there and you know, problem with AIDS, well, people have sex, unprotected sex, and right? It turns out to be a slightly more complex. About why you're having unprotected sex. Upstream determinants. Upstream, you know, conflict, migration, poverty was a part of the sex. Have that sort of, you don't have anything to fall back on to help you cope. Puppies that go on. I will tell you, it will never. Yeah, the uncle of the children, the brother of the husband, inherits the wife and the children of the. What has happened in reality? That's happened in many lands, especially Kenya and South Africa when you look at the literature. Zambia is something different. But some places in Zambia, in a community where there was some, access to the community from the female, not a good idea. That has worked in some places. Access to maybe even just respect. So that's that one, which is, I guess I should have gone to this one more connected. One short other thing. Who did this? Very, very compelling picture of when the lake went south, HIV skyrocketed. How does this work? Well, you have Lake Victoria, very large. Prior to that, there had been extensive or farming practices, whatever. Hyacinths grow really fast. They can increase their. Acres and acres and acres are the hyacinths. But, well, the water hyacinths cause a number of things. So, fish, that annoys you. Bark down there changes. Hiding and predator-prey relationship. Oh, and they're out and fish and come back, and your wife would then sell the fish, and you have to. Or they may have to put in some. those women often been called as, fish for sex, and they're how HIV is being transmitted. Other communities are not getting these fish proteins. Comes out there that the way they link together. Because the snails live, else they didn't have nearly the schistosomyces. So whatever the rules were that did or did not protect the land, that allowed extra sediment and water to go in, what, how you regulate markets and who buys and who sells, and how you decide who buys. Back to look at just food in general from an HIV perspective. Undernutrition makes you more susceptible to the virus. It makes the antiretroviral treatment less viable. It makes you more likely to stop doing it. Actually survive from, so then the thing comes right back into making you sicker. Up there, those are two little. How you look at things affects what you see and what you think the take-home message is. The other thing is, you go to some place like this and you think, okay, I'm gonna try to be a good person and know a lot of stuff. When people ask me questions, I can answer them. We can have a nice community meeting. I didn't have anything to say to them. And I felt bad about it, because they were truly curious. But couldn't help them. All right, that's it. There's some references there if you want. I have all these, most of these. Oh, we did? Wow, okay.
Thanks very much to our panelists for the great presentations and for sharing your experiences with us. Now we can open this up for questions from the audience. So maybe I can start with one. So in Kenya, you've given us two great examples of where policies have either encouraged or allowed great environmental destruction that has had a profound impact on human health. Can you update us on maybe the response from the Kenyan government with regards to either the eucalyptus trees or the water hyacinths? Are things happening to change policies that have enabled the situation to evolve? In terms of policies limiting runoff or agricultural runoff or things that go into the lake, do we know, or under Galena? Back.
Beginning the conversation with, beginning the conversation with a statement, like as I was saying, like the law does, saying women and men are equal. Women and men must have equal rights. Even though we may feel that and that may be our ideal, beginning the conversation with that definitely does not work. And actually, the way that these conversations kind of move is actually to start with often theatre and plays that show a particular issue and then help to show different experiences of a particular incident. So the experience of children, the experience of women, the experience of leaders and all of and different members of the community. And then afterwards we kind of talk, well, I don't personally, we work with our partners, they kind of talk through those things. And I think the most interesting thing that comes up is that when they hear from the perspective of the woman, men's positions kind of change a little. And they say, oh, I didn't even think that my sister is potentially impacted by this practice or this belief that we have. So, as I said, we're kind of in the process at the moment of using those approaches, but I think that that's something that's kind of, that's the important piece, that it's actually facilitating people to see things perhaps through somebody else's eyes within their community. Hopefully that helps.
Yeah, if I could just add to that, I think also the discussion, what I've learned in doing these types of things is two-way. So the community is hopefully gaining some insight into these issues. Hopefully the project, as we heard, is responsive to what they're hearing back. I'll give an example, not related to land rights, but certainly related to women's issues from Nepal. There was a young woman doing a study when I was living in Nepal. She was American, doing a Watson Fellowship, and she went out to these communities where there was a large caste differential, and these communities had a higher caste group of families. And in that caste system in Nepal, if a woman is having her period, she's considered polluted. And so during that period of time, she's not allowed to handle food or to touch a male member of the family, an adult male. And so, and in some cases, it's quite extreme. So the women are forced to sleep outside on the porch, so that they're not in contact with men in the household and things like that. So this woman had this really, aggressive response that this was really unacceptable, it was violating women's rights, and she was going to make it her sort of project to work with these communities to help convince them that this is a cultural change that needed to happen for women. And so she set up a community meeting like this, and as it happened, that everybody who showed up was a woman, which is often the case because the men are off drinking tea or whatever. But they all came around, and she sort of presented her proposal, and there was this incredible outcry, like, what are you doing? We get 5 days a month where they leave us alone and we don't have to work, and you want to take that away from us. Like, you're crazy. And it was an interesting insight into what we had maybe thought initially as being a burden to women, in their perception was actually something that they valued in some ways. So it doesn't mean that as a human rights issue shouldn't be addressed, but how we address it may need to be modified. So I thought that was sort of an interesting way to think about that.
If I can just add to that as well, another example for Kyrgyzstan, for help, brings it back to the legal side of things. In Kyrgyzstan, after the fall of the Soviet Union, a lot of effort to do land reform and break up the communal farms. And one of the things that was part of that was addressing the inheritance laws, which didn't provide equal inheritance rights for sons and daughters. And actually, in some of the work that we did there, we were involved in the revisions of these laws, and some of the work we did there was to go out and speak with the community, speak with women, speak with men, find out what they wanted. Well, there was this draft law that basically gave equal inheritance to sons and daughters. And we spoke with women about it, and the women similarly were saying, no, why would we want that? If our daughters inherit, they'll take that property and they'll take it to their families that they move to, and then who will look after us? Because the practice there is that eldest sons take care of parents in their old age. So there was actually, the women themselves were actually saying, don't make it equal for men and women. Don't make it equal for sons and daughters. Actually, if you can help protect this cultural tradition, which was kind of deteriorating, they thought that would be better, and they wanted the law to actually give all inheritance to the eldest son. So kind of that idea of listening is really, I mean, it's hugely important.
Recognizing that cultures have evolved over many, many years to be adaptive and to be coping strategies for communities. The idea that you're going to come in with a quick fix and have major implications on.
And very often with a very Western view of gender rights.
Right.
Yeah.
Yes, that's right. Yeah.
From the health side, I mean, it's a similar thing. The porch story happens with water. Walk into the community and go, the women have to walk to the river to get water. Well, let's let them not have to do that. And then the women go, that's the only time of day we get to get away from our husbands and talk to our friends. Now I can't do that. Thanks a lot. So, you really have to be careful about what you know is right versus what centuries may have developed into something that you think is wrong, but may be a coping strategy. And they've figured out how to make it work.
Ask one more.
Oh, she had one.
Is there one in the back? Did I see it?
It depends, right? So in northern Uganda, it's customary tenure, so we're working in a Choli land, which is where the Choli people live, and then owners, land elders actually hold the land in trust for the whole country. They allocate parcels to individuals. That's what's happening in northern Uganda. It's very different in other parts of the country. And, Susan was saying earlier, it's really hard to generalise. But at the same time, you can actually have, to your question about whether there are there are disputes, right? So people could be using the land, understand it to be owned by the clan, and governance that is based on custom, and at the same time there could be a law somewhere which gazetted that particular land as a conservation. Very often the case, and no one knows about it, right? And then someone shows up at some point and says, you can no longer use the land as you've been using. Gazetted this land as a conservation area. So, there can be actually competing claims between. And that again relates back to kind of how secure people's land are. How relevant the law is, but also framework is.
It brings up a good point that sort of access to rights. I hadn't thought of this before, but sort of ensuring rights may be just as beneficial as it is for those who gain. Sort of think about, Native Americans and sort of tribes that they wouldn't have seen a value in owning land, at least clearly if there had been some sort of
The government, do you work directly with governments as well? And so what's the government's perspective, kind of seeing the benefits of security of land rights for women in particular and the knock-on benefits of health and development? Then do they want to see more secure land rights, or are they happier with the cultural disbursement of land?
Well, I guess the really interesting trend at the moment, at least in I have worked at that I think there is generally, and actually there definitely is a trend towards recognising customary tenure and not individual tenure, not individual rights as a legitimate form of rights, and that it needs to be treated, it needs to be protected by law and needs to be treated differently. The issue now is more that they don't know how to do it. They know that it needs to happen. They recognise they can't just go into a huge swath of land and say, okay, it once was customary tenure and now we're just going to make this all individual land holdings. They tried that, it failed, and it failed miserably because it just wasn't, individual titles weren't legitimate in that area. As for how they're going to practically recognise customary land rights within the legal system, that question, I mean, many, many countries are trying to do that, and I think they're in the process of understanding exactly. That's why we focused, as we did, on this project in Northern Uganda, because again, it's this question of like, how do you use the legal system, which is, you know, which is increasingly important. How do you use the legal system to help this, but also perhaps improve it a little bit so that we aren't disenfranchising certain members of society?
Is one of the issues, I mean, I think this is true in some places. I mean, we have a very rigid system in this country of identifying parcels. Mm-hmm. And it's historical, and our parcels have always been identified. But in many of those countries, they have no system of identifying, I mean, not only who owns it, but what part of it they own. I mean, yes. there's no system of surveying that is the same country-wide, because we made up the countries after various wars that we fought. So, I mean, the countries are kind of made up anyway, and there's no, so you also, you know, it's not just the law, you have to go out and survey it. You have to know whose land is whose and where it is and how to document that, and that's a whole other issue that needs to be addressed.
And oftentimes, like say, for example, in Rwanda, where it was just the urban areas and land which had been getting parcelized and had was reflected. And actually, after the genocide there was only... the idea of imposing some kind of outside system just may not even necessarily work.
As land access or land use change. Area is another one because of forced migration. We have a lot of families no longer able to not support malaria, or there wasn't water associated with it, or in some cases climate change. All of that is putting different patterns of people at risk for malaria, for dengue virus, for other arboviral infections. That's been well diagnosed. And then finally, I think the other one that aren't emerging that I know about. And so, you know, I think water and land are intimate. Really start thinking about it, there's probably very few diseases that aren't directly impacted by land, and that's not even getting into the whole issue of that means in terms of your willingness to invest in something, health, or be it idle, not in a legal sense.
been interesting studies done in that look at the link between. And I think the general, and I don't want to simplify them too much, but the general idea is that because land is such an important asset, if women have land rights, their status, their power within the household increased, and the likelihood that they would then stay in a household where they are subjected to violence kind of decreases. Thank you. Yeah. So that, and there's some interesting studies.
So yeah, we've actually got a project that's just getting underway. So there's starting to be a larger and larger body of research that also, from an ecological perspective, just talks about people's the health benefit on mental health and stress and the sense of well-being of having access to green land, to land that looks nice. And so in many of these urban areas, I mean, there's just nothing. And so we're starting a project in one of the outskirts of Lima, in one of the informal settlements, sort of to try to test this idea of putting in some household gardens and looking at both nutrition as well as mental and well-being and perhaps even violence and gang-related activities for having something to take care of that's at your house that's green and that you see and just makes you have a nicer life, a nicer view out your window. I mean, there's actually quite a few things out there on access to nature and better, less stress, and some crazy studies that have been done in Japan where they have put businessmen in hotels, and then with some of the businessmen they pump in the air that has the volatile chemicals that come off of trees in it, and the others they don't, and the men in the rooms that have the volatile chemicals in the air from the forest are more relaxed, their blood pressures are lower, they're not as stressed, and they don't even know that. They've just been getting,
They're not smoking these violent chemicals.
Yeah, right. No, they're just... So, I mean, there's starting to be some really, people are trying to figure out why we feel better if we have access to nature. And, that's one of the studies that's been a little bit more creative of well, let's take what it is that you smell when you're out there and pump it into the hotel room, because we all hate hotel rooms, right?
Well, either that or it's just that hotel room air is really bad.
Yeah, or it could be. The control is always really hard.
Yeah. You will join me in thanking our panel for wonderful talks. And we'll see you next week with social determinants of health. And I'll be sure to put Dr. Bolton's references on the website for those who might be interested in reading more. Thank you.
Good job, guys.
Yeah, thanks.
Really wonderful. Thank you.
One very small administrative announcement. Somebody left a scarf in a prior
Water hyacinth.
class, so this is yours. We'll bring it next week, too.
So you can always.
Great. Uh, yeah. It's just name and. Oh, perfect. Glad we asked because I was thinking it was email and name. Yeah, so.
Yeah, if you give me your, yeah, your
Wonderful. Well, thanks for coming. Yeah, great. Yeah, no problem.
great. We love
Have a few extra minutes. today, so it's nice.
you
yeah.
I know I haven't.